Hello dear students and my dear friends, Assalamu alaikum. I hope all of you are fine. In today's lecture we are going to discuss about the branches of abdominal aorta. What are the main branches of abdominal aorta? The three main branches which are present, which rise from abdominal aorta, we will mainly discuss those main branches, right? And the aim of this lecture is to discuss about the blood supply of the abdominal viscera, right? So what are the viscera which are present in the abdominal cavity? We will see each of them and we will supply blood to each viscera in a big detail in different lectures, right? So friends, let us focus on our today's lecture, first lecture regarding the blood supply of the abdominal viscera, right? So as you can see here, I have drawn a diagram, a very simplified diagram, so that you can clearly see everything, and it should be very easy for each of you to understand the blood supply of the abdominal viscera, right? So look carefully, this is our abdominal aorta, right? This part is our liver, right? And we have turned the liver like that, right? This is the visceral surface of the liver. Here you can see this is our gallbladder or the cyst, right? This is the cystic duct, this is the hepatic duct, common hepatic duct, then the common bile duct leading to pancreas, and then into the ampulla fata to the duodenum. So we are not concerned with that, right? We are concerned with the blood supply of the abdominal viscera. Inshallah, we will see the blood supply of the liver also, the blood supply of the cyst, the gallbladder also. Now it is that I have divided each blood supply of each organ to different lectures, right? So that we will clearly understand. There will be no difficulty for us to understand the blood supply of the abdominal viscera. As you can see here that I have drawn a very simplified diagram, right? And in this lecture, we are discussing only this one artery, which is the left gastric artery. And in the next lectures, we will discuss about the common hepatic artery. And in the coming lectures, we will discuss about the splenic artery and its branches in detail, right? So let us discuss about the celiac trunk, right? So first of all, let me mention that this big branch which is in the center present, what is this? This is our abdominal aorta, right? This is our abdominal aorta. Clear, friends? Now from the abdominal aorta, the first two small branches which arise and go superiorly to the sternum, to the diaphragm, right? So these two small branches are combinedly called the inferior Trinic arteries, right? So these are the inferior Trinic arteries. Clear? The first branches which arise from the abdominal aorta, the two branches, the paired branches, or the small arteries which arise from abdominal aorta and move superiorlaterally to the inferior surface of the sternum or diaphragm. We are not concerned with them, right? We are concerned with this big branch in this lecture. What is this big branch, right? So the first large branch, the first trunk which arises from the abdominal aorta, this one, my dear friends, is called the celiac trunk. Celiac trunk. So let us go in detail of this trunk and see the branches of it and the further branches of those branches. Clear? Okay, so there should be celiac trunk. What is celiac trunk? Celiac trunk is a big trunk which arises from the anterior aspects of the abdominal aorta. You can see here inferior to the inferior Trinic arteries at the level of T12 vertebra, right? So what is celiac trunk? It is a big branch of, I can write here, a big branch of abdominal aorta, right? The first and important thing about it. The next important thing, what is that? It arises anteriorly. It arises anteriorly from abdominal aorta. You can see, friends, there are some anterior branches of abdominal aorta, then there are certain posterior branches, and then there are some certain lateral branches, right? So this anterior trunk, the first trunk, the celiac trunk, arises from the anterior aspects of the abdominal aorta, right? So it arises anteriorly, the first thing, and the next thing that is this artery is an unpaired artery. It does not have any pair. It is one artery which arises from that, right? And friends, it arises at level of T12 vertebra, right? So if I draw here a diagram, a very simplified diagram, if here is a person standing, right, friends? I'm sorry. Right, and you can see here are some vertebra which are called the cervical vertebra, and then there are 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, the 12 thoracic vertebrae, right? So then you can see here is our abdominal aorta, right? And at the level of T12, this artery arises, this big trunk which arises from the abdominal aorta. This is called our celiac trunk. So what is this? This is our T12. So this artery, this celiac trunk, arises at the level of T12 from the anterior aspects of the abdominal aorta. Clear? The diameter of this artery, is about 0.78 centimeter, right? If this is the artery which arises from here, this is its diameter, right? And what is the length of this artery? The length of this artery is from 1.5 to 2 centimeters, right? So whenever this artery arises from the abdominal aorta, you consider this is our abdominal aorta and this is our anterior trunk, the first trunk which arises from it, right? So whenever it goes 1 or 2 centimeters forward interiorly when it comes, then it gives off the further 3 branches, right? So we say that the length of this artery is from 1.5 centimeter to 2 centimeter. This is a very little detail about the celiac trunk. Now what are the branches of this artery? What are the branches of the celiac trunk? So look carefully, friends, let me mention there, right? You can see this is our celiac trunk. So when it comes anteriorly, it gives off 3 branches. It gives off how many branches? It gives off 3 branches. One branch is this one, right, which is called the left gastric artery. So let me mention this artery here. I'm writing it very small. The left gastric artery, right, friends? Done with it. The first branch which arises from the celiac trunk, the left gastric artery, moving towards the duodenum, moving towards the esophagus and the margins, the lesser curvature of the stomach and the posterior aspects of the stomach, we will see the branches. Then this is the next branch which arises from the celiac trunk. This is called the common hepatic artery, right? This is our common hepatic artery, and we will see its branches in a big detail in our next lecture, right? And then this is our next artery which arises from this big trunk. This is called the splenic artery, right? This is our splenic artery, and we will see, I'm mentioning again, we will see its branches in a big detail in our next lecture. I have thought that we will record each artery and different lectures, so that for our students and for our friends, it will be easy to understand all the blood supply of the abdominal viscera, right? So this is our, so what are the branches? The first branch which arises from this trunk is called the left gastric artery. Left gastric artery, right? And the second branch is called the common hepatic artery. I think clear. And the third one is called the splenic artery. Splenic artery. Clear, friends? So these are the three branches, the three main branches which arises from the celiac trunk, right? Now let us see the branches of the left gastric artery.